Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from healthcare experts for your journey to Prime Health, both in life and in business. Now, today's guest, Dr. Erik Lundquist, spent years as a battalion surgeon with the Marines in Iraq, and now he's leading a quiet revolution, treating chronic illness without the pills, but more so restoring balance from the inside out. So I can't wait to hear more from Dr. Lundquist. But before we jump into the episode, just a quick message from our sponsor, Growth Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. So with Growth Solutions, we eliminate some of the biggest headaches like new patient lead generation, patient communication breakdowns that may happen. If there's operational chaos, we use proven systems and frameworks. And yes, we do help with AI systems and especially those agents and robots that are coming, whether we like it or not. So if you've ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we could be your growth solution. Just drop the word grow below. One of our members will get back to you, or feel free to DM me at any platform. But you're here for the reason today, and that's to hear from Dr. Lundquist. So Dr. Lundquist, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Thanks, Derek. I'm really honored to have been invited to be on the podcast, and look forward to having a good conversation with you today. My background is in really getting people healthier and feeling better overall. I did an undergraduate training in kinesiology, which is the study of human performance. And early on, learned the impact that nutrition and fitness and sleep and stress management, all of the kind of core foundations to integrative and functional medicine, were really taught to our group there at Occidental College in undergraduate. And so you can imagine I was a little disillusioned when I got to medical school, and it wasn't going to be an expansion of what I learned, but actually restriction in that, okay, now we're focusing on how do we fix the problem, get rid of the symptom, slow the progression of disease by using drugs or surgery or something and it just, I actually got a little disenchanted, almost dropped out, but fortunately went to a conference, heard an integrative medicine practitioner who was a family physician share his experience, and said, okay, there's still a place for me somewhere. Yeah. So after being in the Navy, as you mentioned, and being in private practice with a couple of different family practice groups, I finally got to the point where I felt I was experienced enough and educated enough from a business standpoint that I could actually open my own practice. So in 2014, I opened the Temecula Center for Integrative Medicine with a couple of partners, and we've been open now over 10 years and have a great and wonderful, successful practice. So that's kind of one of the I would say, 3 hats that I wear from a medicine standpoint. I have a real passion for, 1, helping my patients obtain optimal health. 2, in education. I really not just like helping my patients feel better and get better, but actually understand how those things that we're talking about can really impact, so that they can actually be better healers of themselves instead of always relying upon other medical professionals to help them. And then I'm really passionate about teaching other practitioners not only to practice the way we're practicing, but also to have success in business, in applying the principles that they're learning in integrative and functional medicine. So I recently was brought on faculty at the new UCI, University of California, Irvine, fellowship for integrative and functional medicine to run their business curriculum course, which has been a real honor, and really excited about continuing to work on that. So that's kind of in a nutshell, kind of where I'm at right now and kind of what I'm doing.
Okay. Well, thanks for sharing that. I always like to jump back kind of from an origination standpoint. Did something happen in your, young childhood or something along the way that said, what, I want to have a career in medicine?
I don't think there was anything particular. I mean, I always was drawn to the sciences. I thought I would probably do physical therapy before medicine. And I had a couple experiences that kind of shifted me away from that and more into actually a medical career. One was I went on a mission for our church, the Church of Jesus Christ of Latter-day Saints, down in Brazil. And I had the opportunity to, give a spiritual message, help people emotionally and uplift their faith and strengthen their hope. But when it came to physical ailments and there we really saw some debilitated and disease-stricken individuals, I couldn't do anything. And I felt really helpless. And I didn't like that feeling very much, particularly since I've always had this passion that I talked about, helping people feel better, not just from a physical standpoint, but from a spiritual, mental, and emotional well-being standpoint. I felt like maybe it was a little incomplete. So when I got back from my mission and was continuing my education, I thought, well, I'll go spend a summer with a physical therapist and see, intern with him and see what that's like. And all he kept talking about over and over again is, how he was relying upon physicians to get referrals so that he could do his job. And he's like, if you have the grades and any inclination to go into medicine, I would do that. You can always do physical therapy as a physician, but you can't do medicine as a physical therapist. So that's kind of what really shifted me towards that. And so in my undergraduate, my junior and senior year, shifted gears to pre-med and had this amazing undergraduate experience, like I had already mentioned, where we were really focused on human performance. And it really kind of set me on that course, which took a little bit of time to kind of get back to that. But that's really what kind of geared me towards this framework that I now practice within.
Yeah. So it is unfortunate that medicine has made a shift where they believe that medicine is the best medicine. And I think the body gives us and what the environment gives us and what nature gives us, there's more medicine in that than a pill. That's not to say pills aren't needed, because at certain times they're absolutely needed. I wouldn't be against that. But I like the fact that you came from a kinesiology background, understand the body has the ability to kind of heal itself in many ways. So that's good.
Right.
How did you then make that decision to go into the military and become a surgeon that way?
Well, that was financial. When I was in my first year of medical school, they sat us down in orientation and basically gave us the financial lecture and said, "All right, it's going to cost you this much to go to medical school, and it's going to cost you 2 to 3 times that amount to pay it back." And you get out of that lecture, and you immediately have this table of representatives from the different armed forces and other places who would say, "Hey, we can help you pay for your education." And so because I was already in my first year, just starting my first year, I could only do a 3-year scholarship. And I signed up with the Navy because I thought they had the best uniforms and the best, they're all coastal in where they had their hospitals and stuff. So I figured that would be a good choice for my, kind of what appeals to me in terms of where I would like to live. And that's really kind of how I got into that. And then I spent 5 years on active duty with the Navy through my training and with the Marines, and then spent 3 years on active duty in Naples, Italy, where I worked at a hospital that was a NATO support site that was sponsored by the Navy there in near Naples, Italy. And once I finished that and my obligation was over, I tapped out and went into private practice.
Okay. So you went right from there to opening your own practice with some of your friends and colleagues?
No, so that was so I mentioned I'd spent kind of 2 different stints with a family practice groups, right? So I was with I was with two different fairly large entities, and I was a staff employee, physician. In the first group I worked with, I was on call every fourth night, and I was delivering babies. It was a lot of work, and the salary was okay. It was a little better than what I got in the Navy, but not much. Within a couple of years, I was already getting close to burning out, and it just didn't seem like my ceiling for continuing to be able to generate more revenue for the amount of work that I was doing just didn't seem commensurate. And I switched to another family practice group, liked them a lot better, learned a lot from them from a business standpoint, but it was still very conventional, Western-based family medicine. And I remember sitting in with a patient, and she was diabetic, and she was already on 3 diabetic medications, 2 antihypertensive medications, and 1 cholesterol-lowering medication. And her A1C was still like, I don't remember specifically, but somewhere where we needed to do another, maybe 8.6 or something. We needed to do another intervention to try and get that down. And I asked her about her lifestyle. She said, "Oh, I'm trying to do everything I can from a lifestyle standpoint." And so my only option was to give her insulin. And I'm like, this is my only option, is to give her another medication, which I knew, a hormone that was going to increase her fat cell production. So she would have a much more difficult time losing weight, increase her risk for having complications later on in life, because high levels of insulin, we know, cause damage in organs, and she's not getting the C-peptide portion of the proinsulin, which has neuroprotective effects and other aspects that would have been beneficial. So here I am sitting with her, and it was the worst feeling ever. And I had 7 minutes to tell her all this and try and figure this out and get out. Right. So that's when I was like, yeah, I can't continue doing it this way. Even though financially it was a little better practice to be in and the environment was better, I felt like I needed to do something. I had started doing more training in integrative medicine and functional medicine, and had gotten certified through the American Board of Integrative and Holistic Medicine. So I was really saying, all right, this is something I want to bring more. I wanted to bring nutrition. I wanted to bring chiropractic, acupuncture, IV therapy into the practice. And they were just, no, that's too, that's not going to get covered by insurance, or it's too experimental, or et cetera, et cetera. And I just realized, okay, I've got to open my own place. And so that's what really kind of then pushed me out of my comfort zone, because it was a tough, big step to go out on my own. Although I felt like I had a little more business sense. It was, I didn't have an MBA. They don't teach us how to start and run a business when we're in medical school. So I had a lot of lessons to learn, and made some mistakes along the way, and benefited from learning through those mistakes. And we've been pretty successful since then.
Yeah. And now you can help those that you're teaching in the business classes with the school, which is great. Gives them, they don't have to reinvent the wheel, as you say, anymore. So
exactly.
In the conversation that we had pre-call, in this conversation, you being in the military, it sounds like you've been very driven in what you've done. You went on a mission trip that you did. So like, is there a specific, and it seems like you realized there was more to medicine than what medicine was showing you or revealing to you. You went into your own practice, but is there like an internal mission that you do in your own practice that says, this is why I'm doing it this way, because there just is more for patients than what they were being offered?
Yeah, I think for me, I wanted to experience more transformation in my practice, both for me and for my patients. And I knew the way that I was practicing before was limited in what I could offer, and it wasn't very fulfilling from a healing or a healer standpoint. Just writing prescriptions and trying to figure out where they fit in an algorithm, and plugging this into that box and just treating symptoms, it gave me no satisfaction. And I think once I realized, okay, I have within me the capacity to inspire and educate my patients so that they can become something better than they are now and transform into a healthier place. That's really what I want to do. And I knew that I wasn't the expert in all areas, right? That there were other health practitioners who could help me as part of my team in the transformation of the patient. And that's why I knew, having chiropractic and naturopathic and or acupuncture and doing targeted nutritional therapy and IV therapy, I knew that really coming at it from a comprehensive approach would be much more transformational for my patients. For me, that's kind of where I really was inspired. And maybe that kind of came back to that early, mission experience where I was seeing lives change and transform and was helping in the spiritual, mental, and emotional realm, but very little from a physical realm. And so this was now my opportunity to put it all together. And it was very fulfilling and satisfying. And, multiple times having patients, in tears, just saying thank you for the help that they were able to receive and somebody listening to them for the first time. Our mantra at our clinic is that hope and healing start from the time the patient enters the front door, right? Not when they get in to see the practitioner, not when they leave, but it starts at that experience. From the first touch, when an individual meets with our staff right from the get-go, how they experience the clinic themselves when they're sitting in the waiting room, what we educate them on, how they have in their interaction with their practitioner, and then leaving the clinic and experiencing the love and compassion and care in following up with them. So I think all of that is really important to me personally, and then it just kind of exuded itself into the clinic.
Yeah. So how many years has the Temecula Center for Integrative Medicine been around?
So we opened in 2014.
Okay, 2014.
So we've been around just a little over 11 years.
11 years. So back when that started in 2014, how were you received in the medical community for how you were bringing in other practitioners from an integrative standpoint?
That's a good question. I don't know if I fully have an answer to that. What I will say, we didn't receive any open hostility or antagonism to what we were doing. I think because we did not stay in the managed care world, we just did fee for service, so PPO and Medicare. My interaction with other colleagues and practitioners started to dwindle because I wasn't going to meetings. I wasn't in the hospital anymore. I wasn't delivering babies. So we were just kind of in our own little island, right, within our community. But it was clear at least from a community standpoint and from some of the physicians that I had made friendships with prior to starting this, that we actually were being very well respected. And we started having some, practitioners and come and see us as patients, right? They knew, okay, if I'm going to go anywhere to get care, I'm going to come here. So I don't know. Maybe also California, and particularly Southern California, is just more open to alternative types of medicine approaches, and so it wasn't as perceived as what are you doing aspect. We certainly didn't feel any of that either on social media, Facebook, or when we would interact with our colleagues. And most of the time, I would say 75% of the time, the referrals that we would send out, the practitioners would really respect, and sometimes the specialists would send us people, say, hey, can you help this person?
Yeah, that's great. I love to hear it. It wasn't that long ago, but there were times in which integrating with different professionals was sometimes looked upon differently. But I think as you being a leading physician probably in your community and starting that, and then them knowing what your history and your background was, probably helped a tremendous amount, which is great from that. Right now, what do you think are some of the biggest misconceptions that people have still, unfortunately, about integrative medicine?
Yeah, I think there's maybe the biggest misconception is probably more among, my peers than it is necessarily among patients to some extent. And that is that we just focus so much on nutrition, lifestyle, that we don't really practice real medicine because we're not prescribing medications or, referring for surgeries or specialists. And, but I think anybody who has actually come to see us or been involved with us, it really changes. It's been interesting. So over the past, I think it's been 3 years now, we've been involved with the family practice residency program at the hospital. And so those family practice residents who want to do an elective in integrative medicine actually rotate through our clinic. And
Wow.
it's just eye-opening for them. They come in and they go, wow, we didn't know this is what integrative medicine was about. And so I think that there's just still a misunderstanding, misconception that we're not practicing real medicine in some way, but it's clear that when they come in, they leave, they go, wow, you guys are practicing the best of both types of medicine, right? You're still incorporating targeted pharmaceutical therapies when necessary, but you're also implementing lifestyle, and you're really helping patients understand what their environment and their choices, their behavior and their stress management is impacting their overall health. And we love that. And so it's been really fun to kind of get rid of some of those misconceptions, at least in the training world. But I because again, I'm not involved with the community of my peers as much as I was when I was in those other practices. I really don't know what, still some of the misconceptions are, but those would be some of them.
Okay. Well, it's great to hear that when you're bringing students in to view through and see what they're doing in the I shouldn't say students, but I guess they still kind of are, but in the residency program, that their eyes are being open to what's out there. With that same thought process, Dr. Lundquist, would you say there's been a shift in the amount of different types of patients that come through your door for different types of services? Has there been a change in the last 10 years or so of what you see come through?
Yeah, I think we are seeing more and more complex and sophisticated patients than when we first opened. I had kind of developed a reputation as being the thyroid doctor in the community, and so people were coming to see me to better understand and treat their thyroid disorders, and along line with that, some of the autoimmune issues. But over time, we have, I would say the average number of physicians that a patient has seen prior to seeing us is maybe 8. And they probably have on average, 12 to 20 diagnoses, right? So they're fairly complex and so the Temecula Center for Integrative Medicine has really kind of evolved into, although we still do some primary care, more of a specialty center. And we've grown. We now have 4 or 5 practitioners that are seeing patients there, and it's been really rewarding. But what realized is that there's a role for more of an integrative light approach, and so we actually opened another clinic within our clinic called Abundant Health, and it was modeled off of another practice that I had helped with in Texas called Happy Health and Wellness, in which I am now working as a medical director over some of those clinics. And it's basically geared more towards really helping patients be proactive and preventative about their health. So getting in early, we do these elite executive physicals that are very comprehensive look under the hood, looking at comprehensive biomarker testing. But we can identify early lung disease, early cardiovascular disease, early cognitive disease, identify allergies, work on that, and look at them from a functional standpoint and say, all right, what's your overall function right now? And if we are looking at function as the measure of health versus disease being the absence of function, health is not the absence of disease. Health is the measure of function, right? How well do you function? And are you able to do all the things you want to be doing? Because if you're not, then you're really in a diseased state. And that's really what these integrative light clinics are really geared toward that. And then we can use targeted IV nutritional therapy, targeted nutritional therapy, and really kind of hone in on being more predictive and preventative in their care. And so those clinics have been really successful, and we find that we can take care of about 80% of the problems with patients there, and only 20% of those patients who typically come in need a higher level of care like you would get at our Temecula Center for Integrative Medicine clinic. So hopefully that helps a little bit in your question.
Yeah, for sure. What do you do when, I guess it would be for either of those practices that you have, but trust is a big thing now in healthcare. Unfortunately, there's kind of been a lack of trust or losing trust with that. So how do you build that up to the patients that come into either one of those types of practices for you?
Well, I think education is a big part of it, but like I said from the beginning, like we want patients to feel comfortable from the time they enter into the practice. And, and part of that's just how they're greeted. And then we want to establish a partnership with our patients and not have it feel like they're coming in and I'm their health dictator, but I'm really their guide along their health journey. And that together I'm going to make I'm going to give them some advice and share some ideas that I feel if they implement and put forth the effort, that is going to help them get to a healthier place. And I think because I'm not coming in hard and saying, look, if you don't do this, you're going to lose your kidneys, your eyesight, and your legs. It's not a fear-driven practice, really. It's a hope and faith-driven practice where we're hoping to inspire patients to become better than they first walked in. And that builds trust, right? If you take time and you listen to what the patient is experiencing, that's probably the number one thing that we get from our patients is, wow, you actually took time to hear what I wanted to say and had to share. And they feel listened to. And that builds a lot of trust in and of itself.
That's good. I think that's a critical factor that the hospitals don't quite get. And I don't think they understand that they're losing patients because of it, which is your gain, which is a gain overall because you gain with patients, your patients get better health. But a hospital just has to understand that it's a numbers game, unfortunately, but 7 minutes, 10 minutes at max of a crack at a patient, how is that delivering healthcare? It's a very difficult component to that.
Yeah, no, it absolutely is not the optimal way for doing that. We don't do that with anything else that we care about, right? We wouldn't take our dog into a vet and expect them to just take a quick glance and within 30 seconds figure out and then give us the pills and head out. We would be like, what's going on? I'm not going back there, right? We wouldn't expect that on our car if we took it into an auto mechanic and they kind of looked under the hood and, looked at a few wires and said, yeah, it's this, and then out you go and it's still clunking around and you're like, well, just put some duct tape on it or put some earplugs in and you won't hear it, right? And it's like, okay, that's not working very well. Yet we do that with our health. And it's really a shame that we've gotten to a point where not only, well, I don't think as patients, I don't think we're tolerating it anymore overall as a community, but as a system, we're still tolerating it, right? I mean, we're not seeing any big shifts in how medicine is being delivered yet, though the costs keep going up and practitioners are jumping out of healthcare because they're getting burned out, and it's a real problem. And so, I mean, this is why I'm really glad that I'm able to kind of give back a little bit and sharing what we're doing with these fellows so that we can inspire them to practice medicine in a way that's going to be fulfilling, not just for them, but for their patients.
Yeah. With the mantra of to do no harm, you have to take a little time to not be able to do harm. And if you rush that process, it's never a good outcome. It just isn't. It's no benefit for you. you at that point in time need to make sure you've got your malpractice insurance, because you missed something along the way in 7 minutes. If you can't listen to them, there's something in the back end that they're not sharing and you're not finding out as a detective, in their healthcare. And I had an accountant that said, you got to sit next to somebody and press the flesh with business. And that's just the bedside manner. When you have the ability, as you said, to take time and to listen, they'll tell you what's going on. And then you use your diagnostics and your labs to really find where the problem is. It's hidden in there somewhere. Usually it comes out in the conversation.
For sure. And the best malpractice insurance is listening and caring.
Yeah. No, I love that. That's fantastic. For your business right now, what are you guys focusing on for like business growth and to have more people learn more about your business?
Well, I think, for me, it's, since I've got my hand in kind of multiple different business pots here, I'll answer it for me overall professionally, and then I'll kind of dive into where we see things for some of the practices. But I think for me overall, I think my hope is that I can continue to grow and develop as a physician, as a practitioner, and continue to, I love learning and love understanding the why behind things. And so the more I learn about how to care for patients, the better I become as a physician. And so continuing to do that. And then from an education standpoint, I enjoy speaking at conferences, and we'll have opportunities to do that, and webinars, and then working with the fellows and residents to continue to train and educate. So we get more and more practitioners who are seeing an alternative way of delivering healthcare in a way that partners more with patients, so we can continue to see that grow. And then I think from the standpoint of my executive medicine roles as a medical director over multiple clinics, continuing to educate and train those practitioners so that I can influence thousands and thousands of patients to get better care, versus just being in an office where I'm just seeing a few patients and I'm only able to influence and inspire the few patients that I can only see on a day-to-day basis. So that's kind of where I see the growth.
Yeah, I love that. I'm sure you enjoy being the physician that they rely upon. But as you said, it's a one-to-one. And if you can do a one-to-many and be impactful, not only is it impactful to you personally, it's impactful to that patient, but then the family and the vast majority of practices that are out there. You can affect more people than just being the family doctor of the olden days. Not that it was bad, it was needed at that time. And there's small communities that need that, but being able to spread your knowledge base and wealth to others that helps them to help their practice and their community is even better. It's a better way for practice and the vision of the future, I think.
Yeah, I totally agree. I get a lot of joy and satisfaction in working with the nurse practitioners and physician assistants that I oversee, as they bring to me patient questions, and I can answer them and educate them. Now we're the next time they see another patient that comes in with a similar situation, they'll know how to handle it and continue to move forward. And it's just been really rewarding from that standpoint. And I'm really, really happy that I'm in a position that I can influence so many others to practice medicine in a compassionate and caring way.
Yeah, that's great. Do you have any success stories that you can share that have come from the integrative practice that probably wouldn't have happened in a typical family practice clinic in a hospital setting?
Well, how much more time do we have, Derek? I could go on for days, I think, with our success stories. But let me. All right, so there's a few that kind of come to mind. A few that I've shared when I'm teaching other practitioners. One was a young mother who was in her late 30s, came in. She was an ultra marathon runner, so just somebody you would think would be super healthy and fit, but she was really starting to break down and wasn't able to compete at the same level. She was starting to get recurrent illnesses, and then she went into have her thyroid checked and was told she had Hashimoto's and had antibodies towards her thyroid, and that she would likely lose her thyroid and need to have it either irradiated or taken out at some point in time and be on thyroid medicine the rest of her life. And that was just kind of depressing for her. And she goes, wait a minute, I want to get back to where I'm, running ultra marathons and feeling really healthy and can be a good mother for my kids and feel like I'm competent in my job. And so she ended up in our office and just kind of listening to her situation. She had started, what really kind of turned it for her was she had started working as a respiratory tech at a sleep that her lifestyle had adjusted and she wasn't getting adequate sleep, which was impeding her ability to recover. Although she loved doing the ultra marathons, they were extremely physically demanding and stressful on her body. Now she wasn't having or capabilities of repairing appropriately. And then that stress was impacting her gut, which was then creating an intestinal permeability issue. So she, what we call leaky gut. And now her immune system was upregulated and active. And so all it took was a few things. And she had an autoimmune disorder. She was having significant fatigue. She was having brain fog. She was having hormonal imbalances. She was having irregular periods. And all of this really stemmed from taking this job, and it was just too much, right? And so once we kind of identified things, and we always talk about the 5 pillars of health: sleep, physical activity or exercise, nutrition, stress management, and then kind of the environment, which includes your relationships as well as what you're exposed to. Once we started focusing on those 5 things, within a matter of 3 to 6 months, she was feeling as good as new. And she literally, gave me the biggest hug and said, "Doc, you saved my life." Well, I don't think I saved her life. She wasn't dying, but she got her life back. That's what she really wanted, right? She wanted her quality of life back. And nobody was really able to help her. They just wanted to treat her thyroid autoimmune disorder and give her, thyroid hormone, which helped to support her a little bit, but wasn't fixing the problem. And so that's one success story that I think of that I've shared quite frequently. I could share a few more if we have time, or we can move on to another question. It's up to you.
I think that's what's great about that, Dr. Lundquist, is that you helped her, but you helped her family, her kids. If she was married, more than likely her marriage, and then it affected people she ran with. I'm sure her attitude was elevated. Maybe had other people say, "What are you doing in your life that's different?" And say, "Hey, I saw Dr. Lundquist. This is what changed my life." That, like that, the cascade of a positive effect. Because I would hate to hear what would have happened had she gone and taken the typical medical route and had, treatment just with medication and not looked at it. And there's no way they would have sat and had as much time that you spent with her to find out what was really going on. So, I mean, that's where the integrative model, lifestyle medicine, health span, and all those are so important nowadays, that people need to understand that they have to take control of their health and not worried about what their insurance, because it's not health insurance. It's just money covering things. They have to understand they've got to take control of it. And integrative medicine is a way to do that.
Absolutely. Absolutely. And she had been told, look, all your labs are fine, except for we see some antibodies in your thyroid and there's a little bit of imbalance there, but that's it, right? Because metabolically she was fairly healthy. But diving a little deeper, looking at ratios and other things, we were able to see the strain and the stress and pick things up early, right? We were able to be proactive in her health in reversing the dis-ease she was experiencing before it actually got to a true disorder, where now she was having pathological consequences associated with the trajectory she was on.
Yeah. I think this is, you've probably expressed this in different ways, but there are other integrative practices around the country, of course. But what do you feel that what the Temecula Center for Integrative Medicine does that's different than anybody else that's out there?
Well, I think one of the things that makes us unique, and there's a few others out there, but we still take insurance, right? We are an insurance-based practice, and we did that because we wanted to be able to basically throw our net out to as many people as possible, right? Typically, a cash-based practice is going to take care of the wealthy, the healthy, and the desperate. And as soon as the desperate are no longer desperate, they stop coming. And the healthy only come once a year, and the wealthy want you at your beck and command. And so it depends upon, and if you're okay with that and you want that kind of practice, then great. That wasn't the kind of practice we wanted. We wanted a place where we could intervene early, and we knew that in order to do that, we had to catch people early. In order for them to come see us, they would need to use their insurance. And so that's one of the things that we chose to do. There's been significant challenges associated with that because our reimbursements have not gone up in 11 years. We just recently had to add a membership program in order to continue to maintain the quality of care, the amount of time that you just talked about that we spend with patients. We had to have a little additional revenue in order to keep our overhead covered and to pay our staff and keep our doors open. So unfortunately, the cost of what we're doing has gone up, but we didn't want to affect or impact the quality of the care that we have.
Yeah. That speaks volumes to your integrity and ethics of how you practice. And I hope that your patients are very appreciative, which I'm sure they are, but what you do, because I liked how you said those three. I'll have to listen and watch back to this to catch the desperate, the wealthy, and the healthy as to how that goes, because it's very true. It's a very true point. So again, I appreciate the ethics and the integrity that you have in your practice. I'll share all of your links about your websites and where they can reach you. But if somebody is watching or listening to this, how would you like them to be able to reach out and learn more about your practice and your business?
Yeah, so if they're interested in our practice, they can go to tcimedicine.com is where our Temecula Center practice is at. If they're more interested in the integrative light, they can go to abundanthealth.com, or they can go to Proactive Happy Health if they're not in the state of California where we have some of these other clinics. And I think it's, the other thing that if they want to learn more about what I'm talking about, and from a business standpoint, recently started a podcast with my brother called the Root Cause Business of Medicine podcast. They're welcome to find us there. It's on Spotify or Apple Music or basically anywhere you can find and hear podcasts. So if they're interested in that avenue, they can listen to that as well.
Okay. Well, thanks. I'll make sure that all those get in there. So thanks for sharing that. Just two last questions here for us. From a health perspective, if you could give one piece of advice to the listeners and viewers that are out there that could affect their lifestyle in a positive way, what would that be?
Take control of your health. Don't be reliant or dependent upon your doctor, your dentist, your ophthalmologist, whoever you go to get your health care. Don't put your health in their hands, because it's not. The health is in your own hands. So take control of your health. If you want to get healthier, then change the way you eat, change the way you sleep, change the way you live, and you'll feel healthier. You should be using your medical professionals that you go and visit as your consultant to continue to help you do a better job of taking care of yourself. And if you don't feel like they're helping you, stop going. Go somewhere else and find somebody who's going to help you. But you have to take control of your health. If you think that somebody else is going to take control of your health, you're completely misguided and you're going to end up very sick.
Yeah. Are you a coach in sports in any fashion? Because you sounded like that was a coach's talk there at halftime.
I have done my fair amount of coaching in the past, but this is kind of how I talk to my patients, right? I mean, I feel like I'm coaching them. I feel like I'm trying to inspire them. I'm trying to help them realize the amazing regenerative capacity that they have within themselves. This great gift that God has given us to be healed. But we have to give it the right tools, the right nutrients, the right components, and otherwise it's not. If you continue to give yourself processed foods, ultra processed foods, and expose yourself to toxic environments and expect yourself to get better, it's just not going to happen.
Yeah, not at all. I love it. So, Coach Lundquist, Dr. Lundquist, I appreciate what you shared there. That was good. So as a guest here on the Prime Health podcast, everybody has a unique approach to this, but what would be your definition of Prime Health?
Prime Health is doing what you want, when you want, where you want, with the full capacity that you want. That to me is Prime Health, right? Because then I'm not worrying about aging, because I'm worrying about what am I doing and how am I being, right? And if I can be who I want to be and I can do what I want to do, then obviously I must be in prime health. Because if I'm not, my brother says this on our podcast, a sick person has one dream, but a healthy person has 1,000 dreams. Right? Because the difference is the sick person is only focused on getting better. That's their only dream. A healthy person has 1,000,000 dreams because they're unstoppable. They're capable of continuing to do whatever they want. So to me, that's prime health, is really being able to live your life at the highest quality and be able to do what you want.
That's good. I love that one. That one might go up on a little board for myself to pay attention to a little bit longer than that. So I appreciate that. And Dr. Lundquist, I didn't say it, but I do want to say thank you very much for your service in the military. I appreciate it. My family does. It's important. Yeah, it's often overlooked, but thank you for that, that you did it. And I appreciate you being a guest on the podcast. I know you're busy and all the hats that you're wearing, so I'm glad you took them off for this one today to give us some time. And you have a very unique approach to your practice and then how you're helping other people approach their own practices. So you have your fingers in a lot of places, but that's helping a lot of people in many ways, more than you probably know. So I appreciate that from a provider and from this perspective as an outside person learning more about you. So I always want people to, my pleasure. What I think is important during as I wrap up the podcast is people to understand if there's one segment, one sentence, something that can help somebody, please share this with them. Of course, we would love you to share it as many people as possible. But if there's one snippet from the podcast, please share that out. With a podcast that Dr. Lundquist does, listen to it, take advantage of it. It sounds like him and his brother have a great podcast and a great relationship together that you can learn from that. So share them. Yes, if you're on your walk or if you're running, listen to it. But, if we can share the message to more people, we will affect more people in a positive way from a healthcare perspective. And I think that's important. Selfishly, I always say subscribe to our podcast. I would love that. The more people we get to it is great. And until next time, as I always say, remember that your true wellness is a journey that we're all on together. And whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Lundquist, thank you very much for being a guest on the Prime Health podcast.
Thank you. Appreciate the invite.